Good afternoon. My name is Cindy Erwin. I have the privilege of being the medical social worker at SSM Health St. Mary's Hospital Audrain in Mexico, Missouri. I'm honored to be here today, and I appreciate this opportunity to share my passion and experiences with you. Being the only medical social worker between 3 inpatient floors, a cancer center, an ER, and outpatient clinics, I am busy to say the least. If you ever want to know what a social worker's mind feels like, imagine a browser with 2,857 tabs open all the time. This job is challenging and stressful at times, but so rewarding. In a rural health setting, I have the opportunity to work with the same patients throughout their lives, during the first diagnosis of their chronic disease to the beginning of their end-of-life care. In the same day, I can meet with a new mom, a cancer patient, and an elderly patient in the ER needing nursing home placement. Even though each day is different, I follow my call from Proverbs 31:8 to speak up for those who cannot speak for themselves. So today I want to share with you the importance of advocacy. Advocacy seeks to ensure that people, especially those who are most vulnerable in our society, are able to make their voices heard on issues that are important to them, defend their rights, and to have their views and wishes considered when decisions are made. The knowledge, values, and ethics base of social work are designed to equip social workers to take on these roles. We see firsthand the difficulties faced by patients and families who lack the resources to maintain basic human needs for themselves and their families. The situations that often stand out to me the most are families that I meet with in the emergency room with their loved ones. In a medical emergency, rarely do people come to the hospital prepared to be admitted. It does not matter if that person is a first-time patient or have a long medical history. 9 times out of 10, both the patient and family are unprepared, scared, nervous, unsure of what to expect. They're in crisis mode, and they rely on healthcare professionals to provide that plan moving forward. It's common for me to run into these situations like these in the ER. Most often, the patients I encounter are elderly, and their children bring them in because they cannot take care of their parent at home anymore. These families are overwhelmed, and they're at their wits' end, and from my experience, these patients and families are some of the most vulnerable in our healthcare system, and they can easily fall through the cracks. One day, I was called down to the ER to speak with a man I'll call Steve and his family. Steve was a 90-year-old man who lived with his wife in a local community. His daughter had brought him in because he was having more difficulties at home related to his Parkinson's disease and dementia. He was falling, weak, and struggling to communicate his needs. His wife, who was also around the same age, was frail and couldn't provide the basic care that Steve required. At times, the family questioned if his wife also had dementia because she would forget to give him his medication, and they would both skip meals. Steve's wife was at his bedside, and both appeared to be unkept, struggling at home. Steve's daughter had a look of despair, worry, and helplessness. So I introduced myself. I sat at Steve's bedside with his wife and spent the majority of my time with them, just listening and learning. I wanted to learn everything I could about their family, their needs, the resources, values and beliefs, and then their understanding of Steve's needs and prognosis. In their eyes, this was an impossible situation for which they had no guidance or solutions. Steve's insufficient care at home was a chronic issue because the family had started noticing a significant decline in the last year. As Steve's daughter stepped in more and more to help, her concern about her mother's possible dementia had become more pronounced. Unfortunately, Steve and his wife did not have the financial means to pay for long-term care in a nursing facility. In this case, I helped Steve and his family find a facility that met their needs and assisted them in the Medicaid process. Steve and his family were so relieved knowing that someone was dedicated to helping them find a solution. I recently dealt with another situation in the ER with a man I'll call Robert, which also involved his disabled son who lived at home with him. Robert was 76 years old and in failing health due to multiple chronic health conditions. Robert's family brought him into the hospital for fatigue, and at the same time, they were also trying to manage the care of the disabled son at home. Robert's family felt just as overwhelmed as Steve's family had. They were upset, fearful of the unknown, and they felt they had no options. My focus in every case is not just the patient, but the entire family as well. Robert's priority was not his health, but the care of his disabled son. I spent time learning about their needs, problem solving with them, and developing a plan that best served both him and his son. Robert, all he wanted was to be comfortable. He wanted his son taken care of, and he wanted to make sure that everything was going to be okay if he wasn't going to be in the picture anymore. And Robert was happy because I was there with him, and he felt like his voice was being heard because I was listening to him. He ultimately went to a nursing facility on hospice care while the family made arrangements to bring his son to visit him. These situations hold a complex combination of acute medical needs, safety concerns at home, and family resources. My goal in every one of these situations is to help them understand that they are not alone, that they have a voice, and an advocate for their needs. My main focus is being there with them to help navigate the complex and often frustrating world of healthcare and long-term care. I can't come in with a cookie-cutter solution because each situation is different and each family's needs are different. Instead, I often say, it's okay, I'm here to help figure this out. This is my way of demonstrating presence to them and is one of the strongest components of advocacy. My social work training and role as an advocate in the hospital gives me the opportunity to view each patient situation from so many different perspectives and work toward a solution with a whole person approach, but you don't have to be a social worker to be an advocate. As employees for SSM Health, no matter what our job title, we are all empowered to speak up for those most vulnerable among us and help whenever we see a patient in need. In the cases of Steve and Robert, it was necessary for me to take the time to get to know them and their families to learn about their needs, concerns, and priorities. And knowing someone is navigating the healthcare world with them brings patients and their families so much relief. I'm grateful for the opportunity to bring this kind of presence to our patients each day, and thank you for the opportunity to share my story.